The most important challenge in this patient population is the identification of the optimal surgical candidates and also the definition of the optimal timing of when to operate on them. To give neoadjuvant chemotherapy in a primarily inoperable patient is not something that is a defeat or something that would mean we perform lower quality surgery. In contrary, by giving neoadjuvant chemotherapy, we can make patients who would be inoperable. Otherwise, we can bring them to surgery, for example, with extensive liver mets, extensive chest disease. On the other hand, what we have also discussed is that neoadjuvant chemotherapy should not be misused as a way of avoiding higher quality surgery if this cannot be performed in a particular center or hospital. So, in terms of whether any patient with stage 4 ovarian cancer should be operated, we have all agreed yes, they should. It's just important to identify who can do these operations and which patient exactly would benefit. We have addressed the issue of 1 versus 2-stage procedures. So there are patients with, for example, extensive liver disease that would need extensive peritoneal cytoreduction, bowel surgeries, splenectomies, and also at the same time, a hepatectomy, a true hepatectomy, which perhaps would carry very high morbidity. So we discussed about, for example, thoracic cytoreduction at the same time with abdominal cytoreduction. And we are not talking only about the removal of some paracardiac nodes, but really extensive pleural stripping, etc. So what we have discussed there is that we need to see whether a patient would be fit enough and would be able to sustain a multi-cavity extensive operation, or for example, a very large liver resection together with a peritoneal cytoreduction, or whether it would be perhaps more wise or sensible to split it, to do first the one procedure and then after recovery the other, etc. So these are nuances that we have all discussed as experts, also with the audience who had great questions, and such algorithms have been published and have been presented by our societies to the broader gynecology community.